Hi friends, Right Careers welcomes you to another brand new video for this week. This is S. Sudarshan, your career coach. Right, before we move on to this week's topic, a quick update from our side. Right Careers is proud and happy to launch our official Facebook page. Yes, from this week onwards, we are there in Facebook as well. So to instantly get news about various things in education industry, about competitive examinations, about the recent developments in education space, do log into Facebook and go to the page www.facebook.com/rightcareers4u, right careers 4 as in numerical and u.com, facebook.com/rightcareers4u to get all the notifications. Right, so moving on to this week's topic, noble, service, selfless, respect, living gods. These are some of the terms that we relate with this profession. One cannot imagine a world with this profession. Yes, we are talking about doctor as a career. In particular, MBBS, mostly in India. We will talk about the careers and different types of scope in doctors, especially in India. Right? What does a doctor typically do? Doctor typically diagnose the patients with illness or injuries and then comes up with a pattern of solution like prescribing the medicine or prescribing the surgery, whatever it is, and then give treatment to the patient to get cured. So that's exactly what a doctor does. A doctor also works on preventive mechanism. For example, vaccination is a classic example of preventive mechanism. This is exactly what a doctor does in his or her profession. So how does one become a doctor? The career path for someone becoming a doctor, very simple. You got to take biology group after class 10, physics, chemistry, biology. Once you finish your class 12 with high marks, you got to take NEET, which is a compulsory pattern in today's scenario. Irrespective of where you study medicine, be it in India or outside India, if you are an Indian, you got to take NEET and clear NEET. So once you clear NEET, then comes the MBBS part, which is typically a 5.5 years program. 4.5 years of classroom and 1 year of apprenticeship forms the 5.5 years program. And then in case you want to pursue, MD, you got to take postgraduate NEET once again and then pursue a 3-year MD program. So that's exactly the career path as to how one can become a doctor. Now, moving on, what are the types of doctors? There are numerous types of doctors whom we would have come across in all walks of life. We will see one by one. The first type of doctor definitely is in the form of general physician. A general physician is someone who treats you for day-to-day, activities like cold, cough, fever. So these are day-to-day ailments, right? Mild BP, sugar, headache, stomachache. These are day-to-day ailments. A general physician is someone who treats the patients for these kind of ailments. The second type of doctor is in the form of pediatricians. Pediatrician is a doctor who deals with children less than 12 years of age. Usually they work with children on vaccination, primary complex, preventive health and things like this. So this is what a pediatrician do, work with children who are below 12 years of age. The third type of doctor that exists is a general surgeon. Now surgeon is someone who performs surgery irrespective of where, from head to toe, wherever it is. Someone who performs surgery is called as a surgeon. For example, if you're hit with a fracture, to fix it, who does it? It's an orthopedic surgeon who will do it. Similarly, heart transplantation or organ transplantation, all these things are done by surgeons. So that's the third type of doctor profession. The fourth type of doctor definitely is in the form of cardiologist. A cardiologist is someone who deals with cardio and vascular diseases like heart ailments, etc. That's the fourth type of doctor. The fifth type of doctor is a dermatologist. Anyone who deals with hair, skin, nails, etc. The ailments of these three will be called as a dermatologist. The next type of doctor is a gynecologist. A gynecologist usually works with female. They work with female reproductive organs, monitor the fetus as well as the mother during the pregnancy. So that's gynecologist, which you would have come across on a regular daily basis. The next type of doctor is a neurologist. A neurologist is someone who deals with brain related things, like if you're down with strokes or if you're down with Alzheimer or Parkinson's disease, it's the neurologist who helps you in curing that. The next type of doctor is an orthopedic doctor. Ortho is something got to do with injury management. So if you have got something with ligament tear or tendon, bone joint, etc., is ortho, who will help you in curing that. That's the next type of doctor. The next type of doctor is an ENT, as the name itself suggests, ear, nose, throat, ear, nose, throat, ENT doctors who deals with anything, any complex in these parts. There is also radiologist who works on X-rays and imaging technologies to diagnose the problem and then treat you. So these are some of the types of doctors. I've only mentioned a few. There are quite a lot of others like ophthalmologist, quite a few which I have not touched upon. Mostly you would have come across. If you Google it, what are the types of doctors, you yourself should be in a position to know. Moving on, where to study MBBS? Leading institutes, some of the leading institutes that we can think of is definitely AIIMS, Delhi, Maulana Azad Institute, Delhi, and then you have Armed Forces College, Pune, then you have CMC, Christian Missionary College, Vellore, Madras Medical College, Chennai, and then Kasturba Medical College, Manipal. So these are some of the institutes. Every institute that government runs are good to study. Even private universities and private colleges are good. So in your respective cities, which colleges offer MBBS, you can definitely choose to study. As always in our episodes, the pros and cons of this profession. Huge pros to start with. Definitely you save lives, right? What more you want? Someone calls you living God, and that's a huge motivation behind. Besides all the fame, reputation, money, respect, etc., you are able to save lives, and that's the biggest takeaway as far as this profession is concerned. And then job security. Despite all this pandemic, despite all this uncertainty, medical is a profession that will remain certain for ages to come. And then money, obviously you get very good money if you're a doctor. Prestige, definitely, you carry a huge amount of strata in the society if you're a doctor. Diverse job opportunities. You need not work only in government. You can work in private, you can work in government, you can work with NGOs, you can work in colleges as dean, professors, you can practice independently. So diverse career opportunities. Some of the flip side, I would say, the training process is quite long. The structure of the course is such that when you finish your MD, it takes 8 years, 8.5 years of your time after your 12th standard, which means you will start earning slightly late. That's one. The fees is also very, very high if you are going through a non-meritorious quota, by payment quota, etc. The fees is very, very high. Working hours, definitely long. There is no time limit for a doctor. We all know that can lead to stress also. More importantly, a doctor cannot afford to make a mistake. If an accountant makes some mistake, they can always rectify. Whereas when a doctor makes a mistake, it costs a life. So you got to be very, very careful and sensitive about this profession. But overall, if you ask me, this is definitely the noblest profession I can think of, and I'll give a huge thumbs up to this profession. It will always remain an evergreen profession in all walks of life. Thank you so much for watching this video, and thank you all for your encouragement in moving forward. Once again, do subscribe to my Facebook page and YouTube channel. And until next Monday with a brand new video, see you all. Take care. Have a great week. Thank you.